So, dear future colleagues and physiotherapy students, those who have joined in this live webinar for better buffering in the YouTube and better processing. So, we have already covered the two parts, and this is the final part of my demonstration. And you can see I told you that for the tennis elbow, we are having the involvement of the ECRB, and I demonstrated some of the important techniques in the previous part. Please refer the earlier two parts. And yes, so I'll show you the tapping techniques. There is a question some about myositis ossificans. Yes, I'll just talk about it. I'll be touching about that, right? And just support. So as I told you that along with the mobilizations, along with the soft tissue techniques in the tennis elbow, you are supposed to ideally use this along with your, once the pain intensity is subsiding, more pain intensity, go for the positional release technique. Go for the, after the slight reduction, you go for the myofascial release techniques. Along with that, you know, it is always in the stability model of which is the latest concept, the tensegrity or the stability model. We have to work on the passive component, the skeletal component, that is the passive component, and we have to work on the active component. We have to work on the neural component. We have to work on all the three components, and this is very important for the purpose of any manual therapy regional assessment. You have to see that whether it is a passive component involvement, it is active component involvement, or it is neural component involvement. And based on that, we have to, and a multimodal approach is more better and more preferred, you know, combining the passive involvement. Obviously, when there is muscular involvement, the joint gets affected, and it is a sine qua non. It is all present together. And you would have noted also that if somebody is having anytime muscle tear of any region or muscular involvement, the surrounding the joint also gets affected. And when the joint is also getting affected, the soft tissues also gets affected. So it will be happening together because of the normal alteration in the arthrokinetic reflex. So this is something very important clinical pearl that you you strengthen by the eccentric load. You have to strengthen the muscle which otherwise can become weak. So take it for extension and then take it for rotation. This is my clinical experience. I have seen so many patients referring, and there are a lot of publications are also there related to the use of the flex bars. So this is how. Next, once you are done with the lower resistance, that I was using the yellow one, and then we can go for the red one, which is a little bit more advanced training you can go for. And then how much time to maintain? You have to maintain this for about 6 to 10 seconds, and you have to repeat it for about 6 to 10 times. And as a further advancement, we can go for this, this long flex bar, and then you can keep the elbow slight flexion, and it is going to give more better recruitment. And you can see that it is going to give more better recruitment for the muscles. And this also is very useful for the treatment of shoulder problems. You know, somebody with shoulder problems and elbow issues, you can use this, the long flex bar, and you can use this, see, as one advanced training. Because along with the muscle control, and when I'm palpating, I can feel my muscles are properly recruited, and with the mild vibration what it generates, it is going to give or develop fine motor control of the muscles. And very useful for the sports people if we are going for their rehabilitation. Then I was talking about the tapping techniques, for the important tapping techniques, because along with mobilizations, it is always better, and the preferred one what I frequently use is this. Okay, just right. So this is the pre-wrap and the brown tape. This is the rigid brown tape. So I frequently use this, and I also showed in my book. And some people are writing that where it is available. It is available. You can see the details in our website, in Flipkart, and also in Amazon. It is available. You see this. So say this area. Here there is involvement, and then we need to support, because the muscle is oriented like that. We need not have to put it exactly here, slightly below. You can put the under wrap or pre-wrap and give a force lateral and then posterior. Just put a support, first the lateral and then posterior support, because that is going to create the change in the angle of pull of the ECRB. And then obviously from, you just take a measurement in either side. The rigid brown tape should be little extra, at least 1 finger, and then you can just pull it, cut it. Otherwise you can use the scissors to cut it, and then this is the rigid brown tape, and then you just pull it. And this is how you give a support for the tennis elbow patients. And at certain times you can go for a diamond tapping also. You can put the pre-wraps in a form of diamond, both in this direction and in this direction. So then that also offloads the muscle. And sometimes some people prefer to use the kinesio tape also. So kinesio tape also can be used. But in my experience, this rigid tape is quite good. And this is how is the clinical applicatory part I am discussing. And there may be researches, but minimal research publications are there where the efficacy of the tapping techniques. But then it goes very logical that along with the various mobilization techniques, we are going to support with the tapes, and that's how is quite useful. And I'll show you one technique for the loose body manipulation of the elbow joint. Now, loose body manipulations, how to identify the loose body, that I will tell, and how to perform the loose body manipulation, that also I will. There is a demand for the diamond tape, so I'll just try. Yes. Okay. So that will take little time. It will take little time, but it's okay. I'll just show it. So you can go for the diamond tape. You just cut for equal size. We have to give the force so that it is the middle part will be offloaded and it will be concentric forces. So we have to put the force towards the middle. So this is one component. So here is the involvement is there. So this area is the involvement. So you just put it, you pull the force towards the midpoint, one, then another one, again from the lateral aspect medially, other component medial aspect laterally, and then next another component. From here, I'm applying the force again in the cephalic direction, and from here, again I'm applying in cephalic direction. So what has happened is I have offloaded this part, and then on top of that, I'll go for the. So this is the diamond tape, and can go for the brown taping, rigid tape on that. Okay, this is one, the same direction already towards the offloading it, as I told you that again towards the center. So both these components have taken towards the center, and the other one again in cephalic direction. And now this area is relatively offloaded now. This is supported from all the sides, and then that is what we want, because if there is undue stress, there can be involvement of or irritation of the muscle. So that's the thing. And next is about the golfer's elbow, you can see the tenderness, medial epicondyle common flexor origin, there is tenderness, and when you have got the tenderness there, lot of tenderness is there, then you can go for the positional release technique, put the thumb over there, irritable point. Submaximal pain threshold, I am applying the force towards the cephalic direction. You just go for the submaximal threshold and then take the elbow for flexion and wrist for flexion and maintain it for about 90 seconds. So this is quite, and you can do the fine tuning with, elbow is flexed, wrist flexed, and fine tuning towards pronation you can do and maintain it for 90 seconds. And you can use especially in case of golfer's elbow, so I use some, this is the Ethaflex. You can go for the Ethaflex. This is the Ethaflex. This is one material. It is used inside the splints. It is inside the splints. You can see this is the material is already used, and this material you can take the Ethaflex because sometimes there is excessive swelling there, and then you can just take it and support the Ethaflex, and then you can support or put the tape in this area, apply the force slightly in cephalic direction, and because we need a good amount of support. The prime purpose of the tape is to support and offload the structure which is getting more irritated. You see the rigid brown tape, and then you apply the force medially and in cephalic direction. That is how we can manage the golfer's elbow. And next is sometimes due to the pronator teres, I have seen pronator teres muscle leading to entrapment of the median nerve. The pronator teres muscle leading to entrapment of the median nerve, and this is the usual site of the tender point. And what happens in that is leading to there is one condition called as double cross syndrome. So what is double cross syndrome? That along with people with carpal tunnel, the double cross syndrome, which was explained by Upton and McComas in 1979 about the double cross syndrome. So in that case, what happens is if the nerve is compressed at one side, the nerve gets compressed at other side also. So it is not possible to discuss more detail about about the double cross syndrome. So you can just write it down. You can further read about it, because this webinar is not meant for discussing everything about the elbow complex. It is whatever some important thing what is possible that we are covering, because in our Mtfi regular workshops and in our certificate program we spend about one complete day on the elbow complex. So with a short time of about 45 minutes to 1 hour, whatever maximum is possible, that much I am trying to cover. And I know there might be a lot of learned people who are watching it. My intention is not to kind of debate here or display our lot of knowledge and skill, but just to the aim and objective is to kind of ignite some more aspects about rehabilitation of the elbow complex. And that's what I was talking about the pronator teres. Here there is trigger point which is quite common, and if you find a trigger point and lot of irritation is there, then you can go for the PRT. So positional release technique for the pronator teres, I'll just demonstrate. Palpating for the tender point there, applying a force little posteriorly, and then doing wrist is taken for flexion and doing the fine tune 90 seconds, because in the spinal cord level it takes about 60 to 90 seconds for the reflex activity to act. And you can go for the myofascial release technique. You can see from this flexed position and from mid-prone position, from the insertion point of the pronator teres, we can go for, I have to take for MFR two components. I'm taking the supination of the forearm, and then I'm extending the elbow. from flexed position here. Of course, wrist also we can keep it in, not much required, but elbow flexed, and then from mid prone position we are moving towards supination and elbow towards extension, while moving medially and in cephalic direction. That is how we can give. And there is a test to identify the entrapment of the median nerve. So what we can do, elbow in slight flexed, and then from the mid prone position ask the person to pronate, and we have to give the resistance. So while the subject is trying to pronate, we are giving the resistance. With the resistance, if the pain is felt, that means there is entrapment to the median nerve. And after this we can go for the mobilization of the median nerve, and for that I will tell you the position, and you can do it yourself to see the position or to experience the stretch or mobilization, the components for the median nerve. Now the arm is abducted. All of you can do it while you are listening to my talk. The arm is abducted for about 20 degrees. Elbow is extended. So from here, the thumb is abducted. The fingers, and from this position, once again, those of you who have not started, maybe once again you can listen. Arm is abducted for 20 degrees, and then protraction and depression of scapula. You have to do it, then you can experience it. There is a saying, if you do, you remember. So in all our workshops, we make the people practice, and everybody practices thoroughly, and I myself become model to check the. Yes. So once again, there was a little bit of maybe network issue. So once again, I will tell you the positioning. The 20 degrees abduction, protraction, depression, thumb is abducted, forearm is supinated. Go for the abduction. Once you get the stretch response, side flex to opposite side. So in case of Ronda teres syndrome, as I told you, along with the PRT, when the condition is very severe, VAS scale is around 8-9, we are going for the PRT, then we are going for the myofascial release technique, and then we are going for this mobilization of the nerve, which I already showed you the position, I explained, and the subject is in the subject is in oblique position. Subject is in oblique position, and then right. Okay, so this is the okay, and then the arm is abducted for 20 degrees. Come a little out. Yes. Protraction and depression of scapula, and then maybe just focus from this side. It will be more clear. Yes. Right. Protraction and depression, you have to maintain with the pelvis, and the arm is okay. And then we are taking the elbow for extension, and then forearm is taken for supination, and then wrist is taken for extension. That is for the median nerve. We can go for the median nerve mobilizations along with the pronator teres management. Come to sitting position. I'll show you now the elbow joint loose body manipulation. Elbow joint loose body manipulation. Okay. Yes. So what happens is we have just support this. I'll tell you when there is a loose body, what happens is there is maybe this is creating obstruction. Maybe when there is a loose body, there is springy block end fill. In case of loose body, there is springy block end fill. What is springy block end fill? When you are doing the movement stops and rebounds back. So in that condition, we can go for the thrust technique, and because we need another person for assistance, and I don't have enough of man support right now, but I'll show you what exactly we do. So arm is abducted, and the elbow from the flex position, we apply the traction. We can go for the pistol grasp, traction, and you apply the thrust towards supination. We are giving the thrust towards supination while coming from flexion towards extensions. Traction and then thrust towards supination. So this technique is very useful whenever we have got the loose body in the joint, and And what are the indications? As I told you, the indications for the mobilizations are stiffness. So we have got the restriction of supination, we have got restriction of pronation. I have already explained. We are in the part one of the video which is streamed. You can refer that. And that is what we are applying the various mobilization techniques. And I showed you also the thrust technique. These are the conditions. We have got joint issue, stiffness. That time we are going for the mobilizations, and loose bodies, intra-articular, we are going for the manipulation. And already I mentioned the various techniques for the management of tennis elbow, management of golfer's elbow, management of entrapment neuropathy due to pronator teres syndrome. So that was my attempt to cover up whatever best was possible from my side. And there will be, what are the contraindications? That is another important thing. These are the indications. Indications, you have got issues of the joints, muscles, you have issues of the ligament, you can go for the tappings. So what are the contraindications? So those of you who have missed certain part, you can just refer the videos again. Already it is streamed. So already we have extended the time by nearly 30 minutes. It was 45-minute session. I have already covered 30 minutes extra. It is not possible to discuss further. So kindly excuse me regarding that. And just after this, we'll be putting up the videos or the questions for the e-certification. That I'll be taking up one more live video, and we'll be putting up the questions also. And those of you who have got the emails, you have to reply through that email. That instruction I will be giving further. So just to conclude, what are the contraindications? You have got acute fracture displacements. That is contraindications. Myositis ossificans itself is a contraindication. And if you have got tightness of the biceps, that time you should not apply this loose body manipulation. Loose body manipulation you apply till the time the extension is permissible. So that is what I can tell you. And in case of fracture displacement contraindications, you have got inflammatory arthropathies, infective conditions. In those, these are the contraindications. And somebody, a lot of work is presently going on the central processing mechanism. We know that Meljak and Wall gave the pain theory in 1965, and after that, so much of modification they have also done to their theories, and not only through the thalamus or precentral cortex, but also we have issues in the amygdala and other part, reticular system, other part of the brain, and a lot of work is going on that. So psychological components also, that is one yellow flag condition where we see somebody is depressed, there is no proper, we are not able to identify the proper issues of the active component, passive component, or the neural component. Then that time, that is also one possibility is there. So main thing what I can tell you is the structural issues of the joints, muscles, nerves, and ligaments, being the mechanical structures, most appropriately can be treated with manual therapy, can be treated with exercises, and can be treated with the tapping techniques. So that is what. So I'll stop the streaming of this video, and after 1 to 2 minutes, I'll be coming out with those of you who have applied for the e-certification. I'll be coming out with the questions will be kept. I'll be just putting the questions both in form of video also, and we'll put the questions for e-certification, and that instructions I'll be giving you separately. So thank you one and all for joining in this webinar from Mtfi.